let's leverage technology to rely less on specific humans, right? Do you have, let's say, initiatives to make, let's say, knowledge being easily transferable to new people that come in and mitigate the cost of losing someone and make the recruiting and hiring process more efficient? So new hints there, but what's your take on that?
Sure. Yeah, and it's interesting that yes, technology is usually the answer, but in this instance, and what you're saying is 100% accurate from an attrition standpoint for drivers. And when we launched Rapid Medical 6 years ago, one of the things that we did that was a pillar is emphasize the quality of the driver experience, making sure that the driver had everything they needed to be successful, including things like onboarding training, multiple uniforms.
Welcome to Digital Leaders Club. I'm Guillaume Duchesneau, founder and CEO at Ingeno. This show is built for the leaders running real-world operations. And today, that means the people who keep things moving across networks that most of us never see. I'm joined by Joe Prillmayer, Chief Growth Officer at Rapid Medical. Joe, welcome to the show.
Thanks, Guillaume. Thanks for having me. I appreciate it.
All right. So before we get into operational stuff, how did you end up in transportation, logistic, and software?
Yeah, I think my journey throughout my career, I've been in the healthcare software space my entire career. So that's approaching 30 years as of this year. But to give you a quick nutshell of a journey of how I got to Rapid Medical and logistics software, the healthcare vertical is a very dynamic vertical, but yet slow to change. And one of the things I have discovered and very proud of is the network of professionals I've developed over the last 30 years of my career. And Rapid Medical is a 6-year-old startup. And I was referred to our CEO through a former colleague of mine who has navigated a large portion of that 30-year journey with me. And my areas of expertise is SaaS software in the healthcare supply chain and finance space, and the medical logistics space rolls up into supply chain for a health system. So just in a very brief synopsis of that's how I've gotten to this stage of my career in medical logistics software.
Now, tell our listeners about your organization, your operations. What does Rapid Medical actually do? The networks, the customers, the scale. So you said you're a startup, so that's interesting. So can you expand a bit on all of this?
Absolutely. Yeah. Rapid Medical is a medical logistics software and services company. We are a 6-year-old startup. We have deep domain expertise based on our CEO and our founders of logistics in general. And at the same time, Rapid Medical is a different animal in the logistics space. Is we're a software first company supported by our services. And what that means is we have over 20 software developers in-house full-time that design and build our software that we have commercialized to the healthcare and lab space specifically. And at the same time, we have a 20-year history with our founding group around logistics and the courier services, where most individuals might be familiar with the phrase boots on the ground. So we have personnel that we can actually put in a market that will pick up and deliver predominantly lab specimens, pharmacy products. There's a dynamic within the healthcare vertical where a lot of health systems are now moving various services to what's called an at-home model. So where a patient would get certain services normally under the umbrella of a hospital on a campus, those services now are being moved to an at-home model to where the patient receives those same services, treatments in their home. And Rapid Medical's vision is to be the rapid medical solution across an enterprise of an entire health system, multiple departments, but really focusing on that end goal of delivering services and personnel to that patient at home and making sure that that patient experience is above all else 100% reflection of the health system. And that's how we work with our clients from that standpoint. We are a reflection of the clients that we have in our portfolio.
Nice. So you say it's a SaaS platform, but at the same time, you do provide services. So you're using your own platform as well?
We are, in fact, one of the exciting things that I still find at this stage of my career when I'm engaged with a new prospect is talking about Rapid Medical from the lens of our software developers basically build software for logistics professionals by logistics professionals. And
Hmm.
being able to align those two groups of individuals, the Rapid Medical team, along with the new prospect and their logistics team, and that very quickly facilitates speaking the same language, troubleshooting the same problems, and living in those shoes of our prospects and our clients. That I would say competitors don't necessarily have that same approach, because we are the only medical logistics company currently that has both a transportation management system, that's the SaaS software, along with the services component of boots on the ground. And that's a huge differentiator for Rapid Medical in our space.
Yeah, I guess you know what the needs are, right? Because you eat your own dog food, if I can say it like that, right?
Yes, and is that not a great software phrase from many, many years ago type of thing? We actually eat our own dog food. That's 100% correct.
Great, great. Can you share a bit the scale, number of customers you have, and maybe how many are kind of using the platform for their own logistic operations, and let's say the proportion that you serve being yourself the logistic operator?
Yeah, we service clients in over 28 states from that standpoint in the US market. And probably, I'd say, arguably a quarter to half actually leverage the software themselves, because in the logistics world, there are three models, especially in health system. There's an insourcing where they're employed by the health system, meaning the couriers. There's an outsourcing component if a health system decides to use somebody who's strictly boots on the ground outside of the health system. And then there's a third model where it's basically blended or a hybrid model, depending on what needs to be moved. It can be both an in-source and an outsource dynamic. So that combination applies our software, as well as being able to be hired where we leverage our own software, bring our own couriers into a client's environment and run their respective logistics business for them.
Nice. And can you share, let's say, the type of things you move? Is it like drugs and organs and that kind of stuff?
Yeah, no, our big focus is on laboratory specimens. We
Okay.
also move a big trend in our space is the specialty pharmacy aspect of things. And that goes back to that in-home model where
Hmm.
the pharmaceuticals are being delivered at home to the patient from that standpoint. And of being able to also supply our clients with a full chain of custody and optics into that delivery process. I'm an old finance guy, so we talk about mitigation of risk on behalf of our clients on a regular basis. Also in the healthcare space, durable medical equipment. This is your patients who need to have things like wheelchairs and walkers and
Hmm.
infusion care and things of that nature. So that can also be something that we not only pick up, deliver, and track as well. In the healthcare space, a lot of times, whether it's a pharmaceutical or a medical device like a wheelchair, a walker, there's also applicable documentation that needs to be tracked and signed for insurance companies for submittal for the health system to be reimbursed and things of that nature. And we're able to supply that element within our technology as well.
Great, great. And tell me, Joe, what's a typical week? What does it look like for you personally? I want to understand how you actually spend your time, not the LinkedIn profile version, but the actual
Sure.
real thing.
Yeah. In fact, ironically, I was in our Los Angeles office last week for a series of meetings. And one of the things that I had shared with some of my colleagues, and I heard one of them repeat a phrase I had shared with them a couple of years ago when I first got here about when you see one hospital, you've seen one hospital. And that means the business models, while all health systems deliver a whole portfolio of services to their patient. At the same time, the business models can vary greatly based on market, based on the patient population that health systems are serving. But with your question around what's a typical week look like? Well, because we are a software company, I don't know if there's a typical week in a true definition. We have weeks that sometimes look similar. from that standpoint, but it varies based on if we have, for example, a new version of our software being released, so that refocuses our technology team greatly, our operational team as well. If we have started with a new client and we're opening in either an existing market or even a new market, for example. So those all become very atypical weeks from that standpoint. So the only real typical week is that we know it's probably going to be an atypical week.
All right. So that's for your team, but let's say for you personally. So let's say this week, what are you going to do
Sure.
concretely? Yeah.
Yeah, I had part of my marching orders from last week is from our CEO and our board is execute, execute, execute. Because we are in a startup environment still, and we are in a significant Uber growth mode, it is about bringing in, more clients, from that standpoint, making sure our existing clients, renew their contracts, pursue white space in states that maybe we're not in right now, that actually have a high yield from a return standpoint as far as the time invested in getting new clients. Those are types of things. We have a couple of significant conferences coming up in the next month and a half that will have a significant presence at type of thing. So those types of things from a typical week, you run a lot of what I call traps in parallel. You prospect into multiple markets in multiple states. You finalize contractual language for these conferences that we'll be attending and hosting dinners and things of that nature. So there's plenty to do, and I'm never bored from that standpoint, which is a great thing.
Great. So I guess it's the typical, it's a not struggle. I don't know what the right word would be, but for startups, you need to have cash, you need to invest, you need to make sure you have new sales, and you need to stay alive while you do it, right? So I
Absolutely.
guess you're in this typical kind of situation for as a startup.
Yeah, and it's a very exciting area to be in. This is my fourth startup throughout my career type of thing. I've done a number of IPOs in my career, and it's interesting because startups aren't for everybody based on what your palate is for business and business appetite. And at the same time, at this stage of my career, I still get a huge adrenaline rush from the standpoint of securing a new client, particularly that I solve problems for a living. And that's also very exciting when you have a new problem that may be new to a client, but then they see very quickly from our subject matter expertise that we have seen similar problems. And that's one of our big differentiators, going back to that, logistics operator reference around our software, being able to help our clients solve problems that they have run up against that's either impacting patient care, not allowing them to work from an optimization standpoint or an efficiency standpoint. And in the healthcare vertical, probably the two most important things, first and foremost, is making sure the patients are taken care of, and running in a very close second is making sure that we're always looking for savings for our clients. So driving those two initiatives in every client engagement is a huge priority here at Rapid Medical.
Nice. And tell me, Joe, would be the hardest part of, let's say, an organization such as yours that someone outside transportation and logistics probably would not appreciate fully?
Yeah, I think anybody that's new to the healthcare vertical, and this will probably be addressed a little bit later in the show today, but I think it's very germane for our conversation. Healthcare in general is very slow to adopt technology, and also the decision-making process, for example, to get a contract signed, it's a very vertically integrated decision-making matrix within healthcare. So that really makes for long sales cycles. And we're talking in excess of 12 to 18 months, for one software deal. And companies that have not historically had a healthcare background, but they realize the market opportunity is gargantuan in the healthcare space for SaaS and AI, that's probably the first realization that they come into the vertical and realize, wow, this is going to take a lot longer and a lot more sweat equity to be successful than I think most companies that do not have a healthcare background experience in the first year of trying to penetrate this very challenging market.
All right. So all this being said, let's jump into more like technology and data questions. So one of the things that are what I hear though from logistic operators like you is that real-time visibility is it's not it's never completely solved, right? There's always more information you need to know, and being able to have a clear visibility on, yeah, what's going on, where is everything, where is that specific shipment.
Mhm.
So tell me about your system and your own logistic practice. Where do you stand in that aspect?
Yeah, and if I'm understanding your question correctly about, where does real-time visibility come into play? Am I framing your
Mhm.
question correctly?
Yes, yes.
Yeah, and it's interesting because that is one of Rapid Medical's biggest differentiators, because we talk to health systems every day, and arguably probably the top of mind department is specialty pharmacy because of the significant cost associated with pharmaceuticals and
Hmm.
wanting to mitigate risk again on behalf of our clients. And giving our clients a real-time view on not only where in the delivery of the pharmaceutical in the journey to the patient home, but we can not only show them in real time where that shipment is. It's four stops away, it's three stops, in a very Amazon like environment, but
Hmm.
also being able to verify that the correct patient at the correct address received the correct pharmaceutical, not only documented with visuals from pictures that our drivers take, but also from a documentation standpoint of required signature if that's needed, required insurance documentation that in some instances are required, and then being able to have the client, which each client, they get what's called a a portal at their various facilities. So if they even wanted to be able to pull it up themselves versus having to have assistance to do it, we're happy to do either one. But that's some of the feedback that we get very early on, is when the patient was calling and we were able to immediately pull up and tell them where their delivery was at and what time they would be getting their delivery, versus, hold on, we have to call the courier. And that's a kind of a standard line in this
Hmm.
logistics space. And that's something that we get feedback early on, when not only when we're doing demos, but when a client actually signs a contract with us, and they're actually able to do that and see that in real time, which is quite exciting for.
Nice, nice. So yeah, a bit like Amazon, like just like you said, right? It's a
Absolutely.
every step is kind of digitized, and
Yes.
they can self-serve and see where everything is, or you can tell them. But it's if the, let's say, the package has been dropped, everybody that has access to the system knows it's been dropped if they want to know, right?
Correct.
Great.
That's absolutely right.
That's great. And on the fleet side, do you also have telematics, ETA predictions? I know you have electric vehicles. You need to manage the charge on the vehicles, that kind of stuff. So do you have also functionalities to manage that aspect?
Yeah, it's interesting depending on who we're engaged with from a client standpoint, and also what state that client is in. You're making a reference in general to things like sustainability needs and things of that nature,
Mm.
where we've spoken to clients in the past who have actually asked us to submit proposals around a complete sustainability fleet of electric vehicles, because there is a directive in a particular state or a county within a state. There is going on right now in the whole healthcare vertical. There's very much a green initiative around reducing the carbon footprint. And
Mhm.
that's something, again, from the standpoint of, we believe in that in general, not only from an environmental perspective, but also from a business standpoint,
Mhm.
being able to make sure we run the most current vehicles from an efficiency standpoint, and also making sure that we're very cognizant of local, regional, and national requirements of our clients. So we're I grew up in the world of 3M right out of college, and I still apply this particular mantra about, we meet our client where they're at. And
Mhm.
I talk to our team all the time in many instances, because our software and our technology in general is so cutting edge for this space. I always use the comparison to the crawl, walk, run scenario, where as clients start to scale up using our software, they then find other areas that they can problem solve for by leveraging our technology, and sustainability is just one of those.
Nice. So let's say, building on that about efficiency and optimization, can you explain, let's say, the full journey of a package from the moment it's been requested and to the moment it's delivered? Can you kind of
Sure.
break the process down for us.
Sure. And we'll stick with the specialty pharmacy
Mhm.
element because of the need to be able to track those high priced pharmaceuticals. And in many instances, the pharmacy business models vary slightly, but in general, the following model usually applies. Pharmacies usually ship out pharmaceuticals to their customers 3 times a day. There
Mm.
would be a morning pickup, a midday pickup, and then a late afternoon pickup from, let's say, from a rapid medical perspective. And then also when our drivers pick up those packages, they immediately are scanned and go into our system. And that ties into that real-time tracking mechanism. And one of the exciting things among many that our technology team has introduced into the SaaS space is we also have the ability, not only from a tracking standpoint, but also the algorithm that our software has incorporated takes into account things like traffic patterns. And are there lane closures? Are there bridge closures? Does the driver have to deviate from a typical delivery route that he or she has done for a number of weeks, months, years type of thing? Also, we have an algorithm that weaves into that as well, or what we call our extreme weather intelligence algorithm, which depending on segments of the country, whether it's a freezing dynamic up in Minnesota, for example, or a desert heat scenario down in Arizona, all of that's woven into this visual of being able to have the package picked up, scanned, and starts tracking. The algorithm runs in the background around route optimization. That's also how we secure a lot of the savings. We're constantly running the routes through our optimization tool to where we can make sure that we are using the most premium and optimally efficient route to get the package to the endpoint, whether that be a patient's home, a central laboratory. But back to your original question, being able to view that package through the chain of custody, anytime the pharmacy or any of their designees, meaning other departments within the health system, want to know where a particular package is, they can log into the portal and see that. And then also we don't commingle clients. If we happen to have multiple clients in one market, the Rapid Medical is very proud of the fact that we have designated drivers for specific accounts. Again, that's
Mhm.
around making sure we ensure delivery accuracy. So that's part of that mitigation of risk from that standpoint. And as the package is delivered, and a lot of times, depending on what type of pharmaceutical is in the package, it may need to be refrigerated. It may need to be frozen. Some pharmaceuticals can be kept at ambient or room temperature. So we know all of that going in when we pick up the package from the specialty pharmacy. And then in the travel of that package to the end user, again, we are always monitoring the route that the package is being delivered on. And in some instances, let's say, for example, there's an accident. So we need to make sure that the navigation of that accident doesn't impede that delivery time that needs to be very aware of. Depending on, again, the sensitivity of the particular pharmaceutical, we have backups to our backups from that standpoint. We have overlapping routes, if we needed to have that physical package removed from the initial carrier to a second carrier. And again, our accuracy of delivery, not only from an address location, but a timestamp standpoint, all of those factors go into that journey of that package to the end user.
Nice, nice. And let's say a subtopic of all this is, optimizing for, let's call that empty mile, right? So how much of let's say the time a vehicle is moving with an empty load, right? So how do you kind of make sure that you minimize that as much as possible for you and for the customers that use your system?
Sure. Yeah. What you're describing in the logistics business is called a dead leg. That would be a
Mhm.
returning trip type of thing. And
Yeah.
interesting, what we do is to make sure that we mitigate that is that route optimization tool that is part of our software that then starts to overlay additional deliveries or additional routes that would need to be met in a particular market so that we avoid it pretty much all having a courier with a dead leg from that standpoint. And that's how, again, we're able to transfer those savings to our client because of those route optimizations that we do. And there's not a lot of the dead leg route that that hampers Rapid Medical in our business model, just because of the economies of scale that we use and the efficiencies that we use within specific markets.
So let's move on how you deliver features for your customers. And maybe the question I would ask you is, what's the next big feature you think you guys need to work on right now? Is it about data? Is it about giving your customer access to your APIs, but for AI agents, for example? So just brainstorming here, but yeah, what's that typical thing your customers are asking right now that you feel is kind of the next big thing you want to implement?
Yeah, and a great question. And part of what we do at Rapid Medical is we work very hard on being able to anticipate what the future holds. We pull out all our crystal balls and tea leaves and things of that nature. And really the feedback, and this is going to sound like a softball, but anytime we work with a prospect, one of the first questions is, how are you using AI? And that's that artificial intelligence question comes up multiple times a week. And I'm very proud of our technology team here at Rapid Medical, because we've been leveraging AI now for a number of years. We've been in existence for a little over 6 years, and I'd say I've been here 2.5 years, and we've probably been working with AI for a solid 2 years around being able to visualize specimen counts. And for example, when the drivers take pictures of the pickup of the specimens, and they know they're supposed to have, let's say, 5 specimens, and the driver picks up only 4. And they take pictures of only 4. Well, the AI is, we manage by exception. And what that means is that the AI kicks in the software to monitor the pictures being taken. And before the driver can go on to the next stop, the AI will say, wait, you should be picking up 5 specimens. You've only recorded 4. And that goes back, you'll hear a common theme at a great nauseum around the mitigation of risk. And that's something very exciting that we do here at Rapid Medical now with AI. And that's when we do a demo, for example, you see a lot of the prospects that eventually become clients exhale in that part of the demo, because they're like, oh, okay, good. Because our current courier, they're averaging, 30 errors a month type of thing.
Mhm.
And being able to leverage technology, because historically in the logistics space, the solution for everything was throw more bodies at it. And our
Mhm.
CEO, Joseph Yamini, he does a wonderful job of articulating that instead of throwing bodies at it, we look at it through a technology lens. And a lot of it has to do with automation and the mitigation of risk around leveraging things like AI.
Makes sense. So if I frame your answer to my question, what's kind of the next big feature is kind of continue using AI and automation to make this thing, I mean, the logistic aspect of it as less human error prone and efficient. That's in a
Yeah.
nutshell. Did I get that right? Okay.
Yeah. Yeah.
Great, great.
It's all about accuracy in our world.
Yeah, that makes sense. Do you manage warehouses or you're only on the, let's say, transportation aspect of it?
We actually, the short answer is yes, especially with our domain expertise, with our leadership team and our board. We also, you'd asked me earlier, things that that we move. We also do things for a health system that's probably less obvious, but things like mail internally throughout the departments,
Mm,
things like pallets in warehouses, and we're talking pallets with multiple numbers of bins that have to be tracked, and they have to go to certain departments on certain floors, be stored in certain storage closets. And that all is done through our system. And yeah, so from that logistics and distribution component, when you start talking warehouses, is something that falls right into Rapid Medical's wheelhouse as well.
it's about labor.
Mhm.
So from what I hear is the typical driver turnover is really high in logistic, right? So, and it's kind of, it seems to be an industry wide, let's say,
Uh-huh.
concern or struggle. So how do you see this on your side? So I feel you're gonna say let's leverage technology to rely less on specific humans, right? Do you have, let's say, initiatives to make, let's say, knowledge being easily transferable to new people that come in and mitigate the cost of losing someone and make the recruiting and hiring process more efficient. So yeah, new
Yeah.
hints there, but yeah, what's your take on that?
Sure. Yeah, and it's interesting that yes, technology is usually the answer, but in this instance, and what you're saying is 100% accurate from an attrition standpoint for drivers. And when we launched Rapid Medical 6 years ago, one of the things that we did that was a pillar is emphasize the quality of the driver experience, making sure that the driver had everything they needed to be successful, including things like onboarding training, multiple uniforms. That's something that's a requirement of Rapid Medical, whether it's Rapid Medical branding or the client, the health system that we're working for. And also, at the same time, making sure our drivers get paid in a timely manner. And that's something in this space that a lot of the drivers, whether they've done like DoorDash or Amazon or pick a delivery service, that's something that we've been very, very cognizant of, is making sure that the driver is not only successful from a training standpoint, but the environment that they're working in is one that they're very happy to be working in. We're very proud at Rapid Medical to say our attrition rates are in single digits from that standpoint. So we don't have a lot of turnover, and that's because we've focused on making sure that driver has everything they need to be successful from an education standpoint, a training standpoint, a monetary perspective, and also making sure that we've even gone as far as having clients request certain drivers because of their experience with the client engagement aspect has been so good. And that's, again, very atypical of this space. But that's just kind of the environment we create in a nutshell for our drivers, because the drivers are everything for us. That's something that we're very, very proud of. And we've had drivers with us that are with other companies that our CEO has owned, 15, 18, 20 years type of thing. Have been with this core leadership group type of thing because of that driver experience here at Rapid Medical.
Can you expand a bit on what works for this to make this the driver experience better?
Sure.
What works for
Yeah.
anybody else in logistic that is struggling with this problem right now? What can we
Yeah,
do?
no, that's what we have done we've created what's called a Ruby Rewards program. And what Ruby Rewards program is our training and onboarding process that involves not only that training and education component that I talked about, but we also incentivize our drivers from the standpoint of things. For example, we do leverage technology with the drivers where, for example, they have to check in with their phone. And what that means is the car is viewed inside and out, making sure that the vehicle, whether it's a company-owned vehicle or a personally owned vehicle, is clean, it's organized, it has the proper coolers that are assigned to a driver. Again, going back into that frozen, refrigerated, and ambient temperature type of environment. The driver actually has to scan themselves, so they have the appropriate uniform on, and they have multiple 4 choices of uniforms to wear type of thing. So the aspect of getting bored with wearing the same thing every day type of thing. We feel like we've addressed a lot of that. Same day payment for the drivers. The drivers also, they secure their bonuses at the end of the day if they've met certain criteria, from the standpoint of being on time, being efficient, no idle time, not deviating from their routes and things of that nature. So they earn bonus money from that perspective. We also have a reward store where they can buy fuel cards at a discount. And of course, we have a hybrid business model. So we have B2 drivers and we have 1099 contract drivers. So being able to give them those types of rewards and kind of the proverbial carrot and stick, to where they can be rewarded for, good professional behavior, that excites them a lot. And of course, every day they have money in their pocket, because that's how we make sure we do great retention with our drivers, making sure that they have the liquidity, that they need to have out in the field to make sure everything runs smoothly.
Nice. That's pretty neat, actually.
Quite unique, I'll say. And like I said, that's one of the things we're very proud of. Yeah.
First time I hear something like that. So, Joe, looking forward, if you could fix one thing about how your operations run your operation runs right now, something maybe that's been on your list for a long time, what would it be?
I think if I'm looking back at what could be improved, probably to a new level, new degree, as far as being able to onboard a client more quickly from that
Mm.
standpoint. Because a lot of times what happens is clients come to us and they're exiting a previous vendor, and that transition period, whatever the notice on the previous contract is, whether it's 60 days, 90 days, that transition from one vendor to Rapid Medical is always, it can be challenging just from that perspective. And being able to have a very clean, optimal turnover transition from the other vendor, I think would be and I know that we're actually, we look at that every day from the standpoint of how we can mitigate risk around that, and not necessarily a reflection of Rapid Medical, but doing that transition to where the customer can be put at ease when changing vendors.
Can you expand a bit on this and let's say enlighten me and the listeners about what's exactly needed for a customer to be ready to use your platform and work with you guys? So
Sure.
what's that transition look like?
Sure. I mean, it runs in technology, and our boots on the ground run in parallel. And as we transition from a previous vendor model, the client is also getting training on the software platform. And at the same time, there's a lot of moving parts that are running in parallel around, like, for example, we go into a market and we do dry runs on all of the routes before we even take them over, type of thing. And this is
Mm.
usually at least a 2-week experience of making sure that our drivers know the routes. Every client, whether they're small or large, have a few of those high maintenance internal clients. You know, for example, you might have a referring physician to a lab type of thing. And historically, those physicians that can be challenging have very narrow windows of time that specimens can be picked up, for an example. But what we do at Rapid Medical is we actually get a VIP white glove list from the client of which ones do we need to spend more time with to make sure the transition is seamless. And we make sure that we allocate within the business rules, because all the clients have business rules set up. You know, how long do you wait for a specimen pickup? How long do you wait for a pharmacy pickup? If you have some of these VIP white glove internal clients, do we need to spend extra time waiting, you know, and knowing that on the front end? So we build that into the route optimization type of thing. And being able to do things of that nature really helps with that transition. And at the same time, that's also pretty unique, that VIP white glove treatment, because like I said, no matter what health system it is, they have minimally at least one challenging internal client that they
Mm.
have to make sure is handled extremely well versus possibly losing them, you know, to another referral source. So that's something also we've been told for a number of years now. That's a very unique lens that we have when we're doing like a discovery session post contract signature of the business model of the internal clients of a what I'll call macro client, and being able to understand what are some of the challenges, you know, that some of those VIP white glove type clients bring to the table.
So from what I hear, Joe, is so you mentioned driver experience is important, but what you're
Hmm.
describing is customer experience is
Hmm.
also super important, and you make
Oh,
sure
absolutely.
that you understand their needs, and yeah, that speaks a lot about the service you offer. I love that. Joe, can you maybe think of what you see being the biggest opportunity for transportation and logistic operators? So maybe in healthcare in general, but also generally. So how technology, AI could be leveraged and yeah, what's the biggest opportunity for them?
Yeah, it's interesting because depending on, I'll break it up into bits and pieces. Depending on the market is usually what dictates what the next big opportunity is. And what I mean by that, actual states and actual cities. But we've had recently a pretty common theme. Prospects are very interested in, are we leveraging drone technology, for example? And it's interesting because that's one of those very sexy things to talk about right now. And at the same time, thanks to our logistics leadership experience, when we educate a prospect on the intricacies of drone delivery, and then they understand, not only from a regulation standpoint, because you have to get the FAA involved, from flying the drone. There are certain markets that only allow drones in a certain part of the city. There's also elements of weight of packages and things of that nature, which it doesn't surprise me because I've been in the space for so long. But you would think a prospect would stop and kind of think about that for a second from, just throwing out that sexy phrase of, oh, what are you doing with drones? But then when we walk through here, we can do that. But here are some of the heads up or watch outs that you need to be if you want to introduce drone delivery into your business model. And it's all about making sure our clients, first and foremost, prioritize the patient experience. That's the number one thing for us. And then also we then look at, the cost management perspective, because we want to return savings to our client. And then when we go down that path with a prospect, there's kind of that aha moment. Then they decide whether is incorporating a drone delivery into our business model really going to be something that's going to add benefit to the patient experience, or is it just going to really complicate the business model? And it was a sexy phrase to say, and that's what we do in our discovery. And that's the type of stuff we're very adamant when we go to market. When I, for example, confirm an initial meeting with a client, before we do a demo or anything, share pricing or any of that, we want to do a discovery call with the logistics team and the various departments that the logistics team at a client touches. For example, the lab, the pharmacy, durable medical equipment department, the mail department, because all those departments have different challenges that they have to navigate on a daily basis. And that's how we really differentiate ourselves in the marketplace, is that discovery session and really understanding to a granular degree a prospect's business model and how we can help them.
So, for another, let's say, logistics leader who's looking at and watching this, visibility, AI, customer demands, labor, the labor question, and wondering where to start to be as successful as you guys are in terms of efficiency and customer experience. What would be your honest advice for them? So where should I start, Joe? I want to do this.
Yeah, I think I'd go back to my comment about companies that don't have a healthcare logistics background and they want to get into the healthcare vertical is really understand the challenge in this vertical of selling specifically software and technology, because historically, not to be redundant, but the healthcare vertical has been slow to adopt technology and pick any type of technology. That's just kind of the common thread. And also there's not a real good appetite for risk, meaning that a client who would go ahead and purchase our software, but yet they want to know how much risk is involved with the purchase of the software. Is this really going to be able to solve problems A, B, and C for me type of thing, or am I sticking my neck out? So there's a lot of that in the healthcare vertical as well, from my experience of almost 30 years.
All right, Joe, we're almost at time.
Okay.
But before I let you go, I'd like to do a quick lightning rounds of questions.
Okay.
So first thing that comes to mind, no overthinking. So in your opinion, what's the most overrated thing in logistics technology right now?
Most overrated thing. Let's see here. Boy, that's a good one. Probably not having enough visibility into their existing business model with an existing vendor. Not really being able to see into their own business model. Back to our where's your package question.
Right. The one system in your operations you could not run without, aside from your own, I mean.
Yeah, I'd probably say because we're a software company, I couldn't go without our technology team, because they are what differentiate us from that standpoint. And then also from our services team, our customer service, those two things, we're not a company without those two entities.
Right. What do great logistics operators do that average ones don't?
Actually go that extra mile, no pun intended, around understanding a client's business model, taking the time to really, it's cliche, but peel back that layer of that, the onions, being able to get into the granular understanding of a client's business model. In fact, I know that is not done well in general. And again, that's something I think is a big differentiator for Rapid Medical.
And last one, if you were not in logistics, software, healthcare, what would you be doing?
I'd probably be running a fishing charter boat down in the Keys, in the Florida
Nice.
Keys. Yeah.
Are you in Florida right now? Or
No, I'm from Florida. I live in
you're from
Louisville,
Florida?
Kentucky now, but yeah, the plan is to get back to South Florida at some point in time in the next year or so. But yes, that'd be something that actually I wanted to do that even before I went to college. As a young kid, I always wanted to be some sort of fishing charter boat captain of my own, my own boat, and like I'm a big light tackle saltwater fisherman, bone fishing, flats fishing, that type of thing. And I've had that dream since I was probably 14 or 15 years old.
Nice. I love that. I love that. Well, Joe Prillmayer, this was a genuinely great conversation. Thank you so much. I really appreciated how specific and honest you were about what you're doing, and your passion about your work is visible. And this is
Great.
exactly what this show is about. So, Joe, tell me, where can our listeners find you or follow what you are building?
Sure. We have a couple of locations. I'll refer us first to the Rapid Medical website, www.gorapidmedical.com. And then you can also find me on LinkedIn under Joe Prillmayer. And of course, Rapid Medical has a company page on LinkedIn as well.
All right. Thanks for listening to Digital Leaders Club. If you're a transportation or logistics leader dealing with any of the challenges that Joe and I discussed about today, we'd love to continue the conversation. So you can find us at ingeno.ca. Until next time, thank you very much.
Thanks, Gil.